Welcome to the 2024 Open Enrollment presentation for employees. The enrollment period is Monday, March 11th through Friday, March 29th, 2024. In this presentation, I'll go over the basics of Benefit Place, what you need to know and do during this enrollment period, what your options are, qualifying life events, dependent coverage, and more. As part of HR1, Benefit Place simplifies and optimizes your benefits enrollment experience and also provides mobile-friendly online access to enroll or make changes. To ensure a successful transition to Benefit Place, we need you to do your part by checking the accuracy of the information within your Benefit Place profile. Check the spelling of your name and all enrolled dependents. Please use official names listed on birth certificates. Check your Social Security number or individual taxpayer identification number and those for all your enrolled dependents. Check your current benefit coverages and designate your beneficiary for life insurance and update your beneficiary information as needed. If you find errors after reviewing your Benefit Place profile, please immediately notify the benefits administrator assigned to your department. You'll find the list at cityofhoustonbenefits.org. Log in to HR1 Connect at hr1connect.houstontx.gov. Under Organizational Updates, choose the Benefit Place or Open Enrollment tile. Select Get Started from the home page. Review your contact information and communication preferences. Review or add your dependents, then select Begin Enrollment to enroll in benefits. Call the HR Benefits Open Enrollment Helpline at 832-393-6000 for any assistance with Benefit Place. There are no plan or rate changes. For you, this means there will be no change to the current share of cost for pharmacy and medical co-payments, co-insurances, annual deductibles, and out-of-pocket maximum amounts. Here's what you can do during open enrollment. Make no changes. All benefit coverages will roll over if you choose to remain in your current plans, with the exception of the Healthcare Flexible Spending Account. You must re-enroll in the HFSA each year. You can enroll or modify your benefit elections. Add, change, drop coverage. You can also re-enroll or enroll in the Healthcare Flexible Spending Account. You do need to log in to verify your information and to designate your life insurance beneficiary. First, we will review your medical plan options administered by Cigna. The City of Houston offers 3 Cigna medical plans for our eligible active employees: a consumer-driven health plan, or CDHP, a limited network plan similar to an HMO, and an open access plan, or OAP. Let's talk about how these plans differ. The CDHP offers a low paycheck contribution and includes a health reimbursement account to help you lower the cost of services. The city pays for the first $500 for an individual or $1,000 for a family from the health reimbursement account, which can be used to offset your deductible or co-insurance cost. Under the CDHP, you have access to all Cigna providers throughout the country without having to seek referrals or see specialists. There are no copays on this plan, meaning that you will pay 20% utilizing in-network or 40% out-of-network for the cost of your doctor's visits, hospital stays, lab work, x-rays, emergency room visits, and outpatient procedures after you reach your annual deductible. The in-network annual deductible on this plan is $1,750 for an individual and $3,500 for a family. The out-of-network annual deductible on this plan is $3,500 for an individual and $7,000 for a family. Remember that these deductibles are offset by the HRA. This plan also includes a 4-tier prescription drug plan with 20% co-insurance for in-network or 40% for out-of-network. Please take a moment to review the biweekly rates on the screen. These include discounts for non-tobacco users and participation in the annual wellness program. The limited network plan allows you to choose from 3 provider groups: Kelsey-Seybold, Renaissance, and Village Family Practice. This means that you will need to coordinate your care within these networks. In the limited plan network, you have a lower deductible and pay less for services. The limited plan has a $200 annual medical deductible for individuals and a $600 annual medical deductible for family. This plan has set co-payments for primary care visits and specialists. The limited plan has a $150 annual prescription deductible for individuals and a $450 annual prescription deductible for family. The limited plan does not offer a health reimbursement account, so the city is not contributing towards the cost of your services like in the CDHP. If you designate a primary care physician in the Village Family Practice or Renaissance Network, you will need a referral from your PCP in order to see a specialist. If you designate the Kelsey-Seybold Network, you do not need to choose a primary care physician. With this group, you can visit any Kelsey-Seybold office in the Houston and surrounding area. You do not need a referral to see a specialist as long as you stay within the Kelsey-Seybold Network. At the time of enrollment, a PCP will be assigned to you based on your zip code. As soon as you receive your insurance card in the mail, please contact Cigna directly to update to a provider of your choice. You and your dependents do not need to be enrolled in the same network. For example, you may choose a PCP in Renaissance or Village Family Practice while your spouse chooses Kelsey-Seybold. Please take a moment to review the premium amounts on the screen. These are bi-weekly amounts so long as you and all covered dependents are non-tobacco users and complete the annual wellness program. The Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other two plans. The OAP gives you access to Cigna's national network without the need for referrals to see specialists. The OAP has an annual deductible of $850 for an individual and $1,700 for a family. Once you have met this annual deductible, you will pay 30% coinsurance for most services until you reach your maximum out-of-pocket. You will have a set copay of $40 for primary care visits and $65 for a Tier 1 specialist or $80 for a non-Tier 1 specialist. The OAP includes a 4-tier prescription plan with no deductible to meet. Please take a moment to review the amounts on the screen. These are bi-weekly amounts so long as you and all covered dependents are non-tobacco users and complete the annual wellness program. The 3 medical plans have differing co-payments and co-insurance amounts for prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible. This plan is a 4-tier prescription drug plan with 20% co-insurance for in-network or 40% for out-of-network. The limited plan has a separate deductible from the medical deductible, so this is an additional amount you will pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible and offers a tiered copay and co-insurance amount for different drug classifications. Please review the cost of prescription drugs by verifying which tier your prescriptions fall under and carefully consider your options when choosing your medical plan. 90-day prescriptions have a higher copayment or coinsurance than 30-day prescriptions. Specialty drugs in the limited network and open access plans are only available as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express Scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription, which can save several $100s a year depending on your usage. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains, and wholesale warehouse stores, all places where you may already shop. The 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network, including CVS, Target, Walmart, or you can use Cigna Express Scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with the 90 symbol. Cigna has partnered with Cigna Express Scripts to offer savings on many generic and name brand drugs through mail order. Signing up for Cigna Express Scripts is easy and convenient, with your prescription shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetic medications, preferred brand name diabetic test strips, and brand name insulin. Additionally, if you are a member who is not enrolled in Medicare, you are eligible for a free diabetic blood glucose meter. Call Cigna Express Scripts at 1-800-835-3784 to get started. Next, we will review your dental plan options administered by Cigna. The City of Houston is excited to offer 2 dental plans for eligible employees. You have the option to choose between the Cigna Dental Care DHMO plan and the Total Cigna DPPO plan. The Cigna Dental Care DHMO plan is a cost-effective plan that has fixed copays for dental services, with no deductible or annual maximum on services. You will need to select a primary care dentist. and will need a referral to see specialists. The service area includes all of the United States except for 13 states. Benefits start May 1st. There is no waiting period. You will not have to submit claim forms on this plan unless you choose to use services out of network. There is no charge for preventive services on this plan and fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more plan information, refer to cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $50 per individual and $150 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $2,000. The plan is based on coinsurance levels that determine the percentage of cost covered by the plan for different types of services. For example, Class 1 expenses are preventive services like cleanings and certain x-rays and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%. And Class 3 expenses are major services like bridge work and are covered at 50%. To find out if your dentist is in a Cigna plan, go to www.cigna.com. Choose the Find a Doctor, Dentist, or Facility tab. Under How Are You Covered, select Employer or School. Enter the address, city, or zip code. Then select Doctor by type. Select General Dentist from the drop-down. Under Please Select a Plan, enter your address, zip code, or zip after I live in and choose to continue. Select either Cigna Dental Care Access or Total Cigna DPPO depending on which plan you are interested in. Review a list of dentists in the city you typed in. If you need help choosing a dental plan, contact the Pre-Enrollment Helpline at 800-401-4041. If your dentist is not in the Cigna network, you can submit a dental provider nomination form for contracting outreach. Forms are available at cityofhoustonbenefits.org, or you can request one from the Cigna Pre-Enrollment line at 800-401-4041. Next, we will review your vision plan option administered by Superior Vision. With the Vision Plan, there are no deductibles, just simple copayments when you use in-network benefits. You will pay $20 for your annual eye exam and $25 for your glasses or contact lenses. The $25 eyewear benefit includes a $150 allowance towards your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Please refer to the City of Houston's HR Benefits website for more details. Superior Vision offers many providers to visit for your eye care needs, including EyeMasters, VisionWorks, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit www.superiorvision.com. Next, we will review your flexible spending account options administered by task. The city offers two options for flexible spending accounts: the Healthcare Flexible Spending Account, or HFSA, for health-related expenses, and the Dependent Care Reimbursement Plan, or DCRP, for dependent care expenses. The Dependent Care Reimbursement Plan enrollment is held annually in November. Plan changes are effective on January 1st of the following year. The maximum contribution for DCRP is $5,000 per family, or $2,500 if married filing separately. During open enrollment, you can sign up for the Healthcare Flexible Spending Account. The HFSA plan year is May 1st through April 30th. The minimum election is $240 and the maximum is $2,550. The Healthcare Flexible Spending Account allows you to stretch your budget further. The HFSA is a voluntary pre-tax benefit that allows you to set aside money from your paycheck to be used to pay the out-of-pocket medical, prescription, dental, and vision expenses that you and your eligible dependents incur. You never pay taxes on the money you put into your account, giving you more bang for your buck when you use pre-tax money to reimburse qualified healthcare expenses. If you are a current HFSA participant and would like to remain in the plan, you will need to re-enroll to carry your HFSA over to the next plan year. Otherwise, your HFSA will end and you will forfeit any unused funds. How does the HFSA work? You'll select an annual amount to contribute. This will be divided among 24 pay periods. The minimum annual amount you can contribute to the plan is $240, and the maximum is $2,550. There is a $500 rollover into the next plan year, but any amount over that will be forfeited. After you enroll, you will receive a Task MasterCard in the mail. Use it like a debit card at your doctor's office, pharmacy, and more to pay for qualified expenses. You have 90 days after the plan year ends on April 30th to file claims with Task for any expenses that you weren't able to use the Task card to pay for. In addition to copays, co-insurance, and deductibles for medical, dental, and vision services, you can also use your HFSA for chiropractor visits to pay for eyeglasses and contact lenses, LASIK surgery, bandages, first aid kits, hearing aids, medical equipment, lab fees, diagnostic services, and hospital services and fees. For more information about the HFSA, visit cityofhoustonbenefits.org. Next, we will review your wellness program administered by the City of Houston Wellness Team and Cigna. Employees and spouses who participate earn a medical rate discount for their 2024-2025 medical benefits. The first step is the annual exam. Employees and covered spouses, visit your physician for an annual exam by January 31st, 2025 to earn 40% wellness completion credit. You need up-to-date measurements for your blood pressure, total and HDL cholesterol, height, weight, and waist circumference. Step 2 is the health assessment. Employees and covered spouses, use your up-to-date measurements to complete the online health assessment on mycigna.com between May 1st, 2024 and March 8th, 2025 to earn 40% wellness completion credit. Complete steps 1 and 2 to earn your wellness incentive discount. Step 3 is wellness engagement. Employees and covered spouses, go the extra mile to complete the final 20% of the wellness program and earn rewards by completing one of the 5 wellness engagement options between March 2nd, 2024 and March 1st, 2025. The deadline depends on the option selected. Please refer to the 2024 City of Houston Employee Benefits Decision Guide for more information. For more information about the wellness program, visit HoustonWellnessConnection.org. New hires whose medical benefits become effective on or after September 1st, 2024 are exempt from the 2024-2025 wellness program. See the wellness website for a full list of exemptions. Sign up for the Cigna Healthy Pregnancies Healthy Babies program designed to help you and your babies stay healthy during pregnancy and in the days and weeks after your baby's birth. Enroll today by calling 800-615-2906 or connect with Cigna through the Cigna Healthy Pregnancy app. Find the app in the Google Play or Apple App Store. Next, we will review your life insurance options. Dearborn National Life Insurance has merged with Blue Cross Blue Shield of Texas and is now known as Blue Cross Blue Shield of Texas on customer service lines, forms, and communication materials. The city provides all elected officials full-time and designated part-time 30 employees with basic life insurance. You will be covered for a group term life insurance policy at 1 times your annual base salary, rounded to the nearest 1,000. With submission of appropriate documentation, your spouse is eligible for a $2,000 life insurance benefit. Dependent children up to age 26 may also qualify for a $1,000 life insurance benefit. You have the option of purchasing voluntary life insurance up to 4 times your annual base salary. As a current employee, you may elect or increase your voluntary life insurance coverage only during open enrollment. An EIO form must be completed to be considered for approval. This may take up to 45 days for a decision. As a new hire, you may elect to enroll within 30 days of your hire date and can select up to 3 times your base salary without completing an evidence of insurability form. All elected officials, full-time and part-time 30 active status employees of the City of Houston who have completed the initial waiting period may apply for voluntary life insurance. A full-time employee is an employee working 40 hours per week. A part-time 30 is an employee that works at least 30 hours per week. Seasonal, temporary, and part-time employees are not eligible. Duplicate voluntary life insurance coverage is not permitted as follows: as both a city retiree and a city employee for the same benefit, as both a city retiree or city employee, and as a dependent of a city retiree or city employee for the same benefit, as a dependent of more than one city retiree or city employee for the same benefit. Any individual found to have duplicate benefits coverage for the same benefit, including life insurance, will be automatically dropped from the duplicate coverage. Employees currently enrolled in voluntary life coverage can elect to enroll their eligible dependents only during open enrollment, and they are subject to evidence of insurability requirements. Here are some things to consider about life insurance. You will need to log into Benefit Place and designate your life insurance beneficiary, even if you have done so previously. Life insurance is not always so simple. Life insurance benefits cannot be paid to anyone under the age of 18 without legal financial guardianship documents on file with the courts. If you are interested in naming someone under the age of 18 as your beneficiary, you must have proper legal documents drafted that allows them to access their funds. Otherwise, the funds will go into a trust until they reach the age of 18. If you experience any major life changes such as marriage, divorce, birth of a child, death of a loved one, we strongly encourage you to update your beneficiaries. You can update your beneficiaries at any time. When you list your beneficiaries, remember that primary beneficiaries are those that will absolutely receive the amount listed. Secondary beneficiaries will only receive life insurance funds if the primary beneficiaries are no longer living. If you have elected life insurance coverage for your dependents, you are the only beneficiary on those plans. Next, we will review your supplemental insurance options administered by Continental American Insurance Company. The city offers 3 supplemental insurance plans: the Group Hospital Indemnity, Group Critical Illness with Cancer, and Group Accident Insurance. They will help protect you and your family against unexpected costs due to medical conditions and hospitalization. Individual and family supplemental coverage may be a good fit for some employees who want extra financial protection. It's important to note that Group Hospital Indemnity and Group Critical Illness with Cancer are pre-tax benefits, which means you can only add or terminate the plans during open enrollment. The Hospital Indemnity Plan helps cover the costs associated with hospital visits and surgical procedures. This plan reimburses you after you file a claim, which can help lower the out-of-pocket expenses associated with unexpected medical conditions and hospitalizations. Some of the benefits include a $100 per day for ICU stays up to 30 days, a one-time hospital admission benefit of $500, $150 a day for hospital room confinement up to 30 days, a $125 benefit for outpatient surgery, and a $50 benefit for health screenings. This is not an all-inclusive list, and some exclusions or limitations can apply. More information can be found on the Benefits Division website at cityofhoustonbenefits.org. The Group Critical Illness Plan pays a lump sum benefit if you are diagnosed with an approved major occurrence, including cancer diagnosis. You can receive up to a $20,000 lump sum payment paid directly to you upon diagnosis of cancer, heart attack, stroke, coma, major organ transplant, kidney failure, burns, and more. This is not an exhaustive list of all covered occurrences, and some exclusions or limitations can apply. Please refer to the plan documents on the Benefits Division website for more details. Group accident insurance covers the cost of expenses due to an accident. Expenses such as ambulance rides, emergency room visits, surgery and anesthesia, prescriptions, major diagnostic testing, and burns. Benefits are paid directly to you unless otherwise assigned. Coverage is guaranteed issue, which means you may qualify for coverage without having to answer health questions. Benefits are paid regardless of any other medical insurance. For the first time, supplemental insurance enrollment will be available in a central location through Benefit Place. You may call Continental American Insurance Company at 888-687-1883 if you have any questions or need additional support. Now we will review the Employee Assistance Program administered by the City of Houston EAP team and guidance resources. The Employee Assistance Program, EAP, is a free benefit provided by the City of Houston to employees and their immediate family members. EAP counselors work in a consultative role with managers and supervisors to address employee and organizational challenges. The City of Houston uses a hybrid model, both internal and external EAP. The City of Houston's internal EAP offers confidential counseling that helps address stress, relationship, or other personal issues you or your family may face. Our team is staffed by qualified clinicians who will listen to your concerns and can refer you to in-person counseling and other resources to help with anxiety, depression, marital conflicts, problems with family, job pressures, grief and loss, and substance abuse. Additionally, our internal EAP offers several educational seminars throughout the year, including anger management courses, stress management, and more. Call 832-393-6510 or visit 602 Sawyer Street, Suite 410. The City of Houston EAP Guidance Resources addresses work-life balance issues by providing practical information and referrals. Child care and elder care, educational options, community information, event planning, home improvement, buying and selling a home, relocation assistance with shopping and locating items. Through Guidance Resources, EAP can also offer legal resources, providing you with a qualified attorney in your area for a free 30-minute consultation and reduced legal fee rate. They can also assist you with financial information and resources by providing CPAs and financial planners who can assist with tax questions, retirement planning, and getting out of debt. If you have a problem, even if you think it's not a covered service, try contacting Guidance Resources. Call 855-378-7485. You can access EAP by contacting the City of Houston internal EAP at 832-393-6510 or Guidance Resources at 855-378-7485. You can also email Employee Assistance Program at houstontx.gov or visit the Guidance Resources website at guidanceresources.org for more information. The final paycheck beneficiary form is provided for you to an elected beneficiary to receive any pay which you would have otherwise received payable based on your employment. Pay includes but is not limited to wages, the value of unused vacation accruals, compensable sick leave, modified sick plan, and paid time off owed to you upon your death as an active employee. Please note that it must also be notarized if you are married but your spouse is not the sole primary beneficiary. You can visit a notary public that is convenient for you, or the Benefits Division has several notaries available at 611 Walker on the 4th floor. If you are a single participant or married with your spouse as the sole primary beneficiary, no notary is required. Outside of open enrollment, the only other time you can make changes is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common qualifying life events are marriage, birth or adoption of a child, divorce, gain or loss of other coverage, and moving outside of the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26 over whom you have legal guardianship or legal foster care, grandchildren up to age 26 if they qualify as your dependents for federal income tax purposes and live with you. Ex-spouses are not considered eligible dependents unless a court order has been issued that states they will need to be covered on your health plans within 31 days of the event. Contact your benefits office for full details on ex-spouse eligibility. Step-grandchildren are not considered eligible for benefits purposes under any circumstance. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled, and covered on a medical plan before reaching age 26, and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide health care coverage, you must provide the Benefits Division the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The city requires proof of identity such as a Social Security card or ITIN, and proof of eligibility such as a birth certificate, certified marriage certificate, or legal adoption paperwork. Please be advised that you will also need to provide all dependent Social Security numbers and dates of birth to enroll. A list of documents is available on the Benefits Division website. For Open Enrollment 2024 must be submitted through Benefit Place through the Documents Center. If you are adding a dependent, you must submit your supporting documents by March 29, 2024, no later than 11:59 p.m. Central Time. If both you and your spouse work for the City of Houston, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the City of Houston. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing benefits@houstontx.gov or calling 832-393-6000. You can also view more benefits information on our website, cityofhoustonbenefits.org.